whenever you have pain, it's because energy is blocked. Energy is not flowing in that spot. When you have surgery, and the reason that I believe that surgery can be miraculous is because when you have surgery, here's your energy here, and the operation will take you here.
Welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Vanbergen, and today we're going to be diving into a topic that affects so many of our listeners, which is how to recover from surgery with less pain, less swelling, and better long-term outcomes. Whether it's a hip or a knee replacement, a spinal fusion, or even an unexpected emergency procedure, surgery can feel overwhelming. But what if there were ways to prepare your body so you heal faster, so you reduce complications, and so you support your energy and immune system every step of the way? Well, our guest today is Dr. Shiroko Sokitch, and she brings a truly unique perspective to this conversation. Dr. Shiroko is the founder of Heart to Heart Medical Center in Santa Rosa, California, and has been helping patients heal since 1993. Trained in general surgery and having spent 10 years as an emergency room physician while simultaneously attending acupuncture school, she bridges the best of Western and Chinese medicine in a way that few doctors can. She's also the best-selling author of Healing When It Seems Impossible and is currently working on her new book, Sailing Through Surgery, which focuses on how patients can dramatically improve their surgical outcomes. In today's episode, we will talk about the most common side effects people experience after surgery, and how to reduce swelling, pain, and recovery time. We're going to touch upon why preparing your tissues, nutrition, hormones, and nervous system before surgery can change everything. We will touch upon what to avoid prior to surgery to maximize healing, how energy flow in the body shifts instantly during surgery, and why blocked energy will just slow recovery. We'll also dive into the role of Chinese medicine in supporting balance and whole body healing. And touching on something we know here at Pain Free for Life, a little bit of scar tissue and energetic blockages, and how even in emergency surgeries, tools like homeopathy, including remedies such as Arnica, can support trauma recovery. This is a powerful conversation about blending the strengths of Western medicine with energy medicine, hormone balance, immune support, and whole body healing to create the best possible outcome. So without further ado, let's jump in. All right, Shiroko, welcome to the show.
Thank you for having me. I'm happy to be here.
So I'm super excited to talk today about surgery. And I believe you're working on a book called Sailing Through Surgery. Is that right?
Yes.
All right.
Yes.
Tell us a little bit about that.
About the book or about the whole idea?
Well, let's go with the whole idea, and yeah, we can kind of just weave through it.
Okay. Well, originally when I trained in medicine, I trained as a surgeon. And I had 2 years of a surgical residency before I decided that that was not my career path. And then I moved to work in the ER and then studied acupuncture. So I've had a interesting trajectory, but I always have felt that surgery can be miraculous if it's done the right way. And I have been in practice now for 32 years, and I've helped many of my patients get through surgery in a way that makes it so that they have the least amount of side effects and the best outcome possible. And, it's even though I practice Chinese and functional medicine mostly, I believe that there are tools in Western medicine that are very helpful and can potentially, of course, change or save your life. So I decided that I wanted to share it with more people, and I decided to write this book, Sailing Through Surgery, to help other people who maybe not my patients find ways to have the best possible outcome from surgery. So.
I know, and that's great because it is something I don't really know if there are that many resources out there on surgical recovery. I think people have this idea in their mind that they take medications and they just rest. And they'll get through it in the end. But surgical recovery times can be very extensive depending on the surgery. So
What sort of timeline, like, can you see a decrease in like the timeline of recovery by doing these things that you're going to be discussing in the book?
Yeah, well, I have had several patients, or since, I've been doing this for years, but I didn't get it really formal about it until the last few years. And I have had several patients who've sort of instigate or done my program and done amazing. So, like one lady who's 80 and she had a knee replacement. And, when you're 80, there's all kinds of things that could go wrong. And she followed my protocol exactly. And she literally had very few days of pain and was able to walk pretty quickly without pain medication, and has had no problems since, which it was a couple years ago. And another patient of mine who ended up having to have a hysterectomy, and same thing. She followed my protocol. She came and had acupuncture beforehand, took the supplements I recommended, and actually had some other positive benefits from those supplements. But the second day I gave her acupuncture, and she was already without pain medication and walking, and hysterectomies can take like 6 weeks to heal.
Yeah.
So yeah, I have some pretty amazing success stories. I have other patients who, still had a fairly long recovery track. So it's everybody's different, but she also didn't do everything I said. So I don't want to say that they have to do everything I say, but
Well, that's always the case, isn't it? Like, some people will follow the plan to the letter, and other people, it's like, oh, maybe I'll just avoid this. And it's funny how subtle little things can actually make a big difference, especially
yeah.
with some of these protocols. Now you mentioned like this is about helping teach people to get through surgery or sail through surgery with the least amount of side effects. So, what sort of side effects do most people experience, like from a surgical? I mean, obviously that's different per surgery, but what are the common ones that people might be worried about?
Well, it depends on what the surgery is, of course. Um, Originally, when I first started helping people sail, there were patients of mine who were having plastic surgery,
Oh, yeah.
and so on their face, and so a lot of swelling, not necessarily the face, because there's not a lot of moving parts. So it's not necessarily as much pain, but a lot of swelling and a recovery time of not looking as good as they'd like for a while, right? Um, so some of the supplements that they take have reduced the swelling. And I actually have in the local area where I am plastic surgeons who now give their patients the things that I give my patients, like the Arnica and things like that, to help reduce swelling and to help speed recovery time. So swelling, pain, uh, again, if it's a digestive surgery, it might take a long time to get digestion functioning properly. Joint surgeries or joint replacements, getting movement happening and being able to be pain-free. And the thing that often leads to joint replacements, of course, is sort of a chronic pain that they've dealt with for a long time before they get around to having the surgery. And then, still having pain after they've had the operation, made sometimes for months. I've had patients who had joint pain after they had a knee replacement for months. They were the ones that didn't do the physical therapy exercises, and, you know, didn't necessarily follow any kind of guidance, even mine, but not their surgeons either. So, um, uh, but those are the things that, take time, is recovering and getting their function back. I myself had eye surgery last July. And, of course, I followed my protocol. But I remember the surgeon telling me, "Oh, you'll only be a week out from work." And it was longer. It took longer because I had a problem with double vision. So it was not a normal eye surgery. And it was a double vision I'd had most of my life. And and he corrected the movement of the muscles of my eyes. And it took a while for my brain to get used to the new position of my eyes, but a lot faster than, like, I think because he worked on kids mostly because it's a problem kids have, not adults. So um it took longer than he
Yes.
predicted, but I don't know how long it would have taken if I hadn't done the protocol that I have. So
For sure. Yeah, I mean kids tend to recover quicker in most ways for from things,
yeah,
don't they? Yeah,
yeah,
they have that those young cellular regeneration things on their side. Uh
yeah.
yeah, I suppose I'd say most commonly for our listeners, it would be things like hip and knee replacements, super common, and spinal fusions is another one as well that I've seen a fair bit of.
Yeah. Yeah.
And so there's obviously the same thing, right? Lots of swelling, lack of mobility, and things like that that can really throw people off. And I do hear about it a lot about people that go into surgery for pain and come out with the same amount of pain for at least a while, sometimes longer. And so obviously there are things they can do if they want to try and avoid that. So why don't we look into that? So what sort of tips do you have to help people have less pain? And also less trauma because surgery can be traumatic as well.
Well, first of all, because I do acupuncture and Chinese medicine is based in it, and Chinese medicine, the whole idea is that you're made of energy and energy travels through your body in certain patterns. And whenever you have pain, it's because energy is blocked. Energy is not flowing in that spot. So when you have surgery, and the reason that I believe that surgery can be miraculous is because when you have surgery, here's your energy here, and the operation will take you here in a moment, right? And nothing else does that, like where you can shift from here to here physically, like surgery. So that is a huge shift. And it's something that needs to be taken into account when somebody's considering having surgery or when they have had surgery, is to remember your body was here before and now it's here, no matter what the operation is. Like if you have a piece of your colon taken out, or you have open heart surgery, or you have a joint replaced, you no longer have the same body. And it's within a short period of time that shift occurs. You can heal a joint. Like if you have an injury to a joint, it takes weeks of certain kinds of exercises to strengthen those muscles and to get the support of that. So that's the first thing that I talk to people about, is that big shift, and to imagine themselves it's like as if you jumped across a river, right? Imagine yourself on the other side of that river already well. So that's the first thing, is to keep thinking of that, knowing that this is a big shift, to keep thinking that shift is going to happen, and how valuable it is, and what a great possibility of healing that is. And then the next thing is to do certain things to prepare your body. So, of course, before you have surgery, the healthier you are, the better it is going to be for recovery. So to maximize all of the support of your tissues and your organs that you can. So that's, if they're my patients, usually I do all that work with them for a long time before they get to that place where they have an optional surgery. Of course, if there's an emergency, that's an entirely different world, but you can still recover, and you can still use those tools to recover better, knowing that sort of shift has occurred. I have people, maximize the vitamins, maximize their protein intake, maximize their digestion so that everything works well and that their tissues are in the best position for healing. If I have a month before the surgery, then I have them take those, certain supplements like vitamins and omegas and things. And then right before the surgery, there are certain things you have to cut out, like things that would make you more likely to bleed, like omegas and vitamin C and vitamin E and things like that. So certain things have to be cut out a few days before the surgery to make sure that the bleeding isn't more. But if you tank up, so you tank up your system before the surgery, then you have your tissues be at their ultimate healthy level. I also work with lots of people with hormones. And so I have this thing, I've written another book called Healing When It Seems Impossible. And on the physical level, I have a philosophy about hormones, nervous system, and immune system. And that's what I call the triangle of wellness. And getting the hormones, the nervous system, and immune system balanced gives you the tools you need to heal from anything. And so I always try to optimize everything. And for people as they're getting older, sometimes their hormones are out of balance. And having less hormones, I think, is one of the reasons that tissues don't heal so well. And so if I have a person who's on low, not got balanced hormones, I try to help them balance their hormones.
Makes sense. Hormones are one of those things that certainly cause a lot of problems for a lot of people. And it's not something that we really have, like a Pain Free for Life, we really have a tool to deal with hormones. So it's always interesting to, try and find different resources for people to balance those out, because I think that one of the things people don't really think to look at. You don't necessarily connect hormones with healing in your mind when you're thinking about these things originally, right? So
Exactly. Yeah. Well, and in the world that you deal in with chronic pain, hormones play such a big role, because when you're in pain for a long time, your hormones start to be depleted because you're chronically stressed, and chronic stress causes hormones to go out of whack. And helping deal with chronic pain or with surgery, you want balance. You want more support of that sort of thing, in order to help the body do well.
Right. Yeah, absolutely. And so you mentioned emergency surgeries. Obviously, this is in a world where you're not necessarily prepared. Hopefully, everyone's, doing stuff to keep themselves healthy anyway, so they may be in an okay space. But for example, I had an emergency appendectomy, right? My appendix was going to blow, so into surgery I go. Didn't see it come in, woke up one morning, and then I'm in surgery. So, for people in those situations where they do have to have an emergency surgery, if it's minor or it's major, um, is it really just about then coming in and instead of front loading these things, you're then just doing them after the fact to accelerate the healing process?
Yeah. And there's a couple other things. There are a couple of homeopathic remedies that I recommend a lot. One is called Arnica. You probably heard it's a good pain remedy. But arnica can help a lot in terms of pain and swelling. And it's actually one of the things, like when I first started doing all this with people who were having plastic surgery, I had them take arnica before the operation and after as soon as possible. It really reduced the amount of swelling in their faces. And that's the thing that plastic surgeons now get and locally give their patients. But the other remedy is called aconitum napolum. I always call it aconite, but it's a remedy that is for trauma.
Oh, yes.
And if you look at it in the like Whole Foods or in one of the health food stores, it'll say that it's for catching a cold suddenly. Because when you have a trauma or an impact that's sudden in your body, it can knock you out of your body. And this remedy, so if you get knocked out of your body, one of the things that can happen is you can suddenly get a cold, but also you can also be kind of separate from your body for a while because of the trauma of that. And surgeries, on a certain level is a big trauma. So taking aconite helps you come back in, and it helps because it helps reduce the physical element of the trauma and the emotional element of the trauma. So especially for emergency surgeries or emergencies, I give people that remedy all the time. We had big fires here where I live a few years ago, and I gave everybody this remedy because it was so, like, the whole community. We lost 6,000 homes, um and the whole community was devastated, and people died, and um you probably heard about it. It was in 2017. So but so yeah, so that's one of the important things, especially with emergency surgery, is to take that remedy because it helps you come back in your body, and then that makes you be able to be present for the healing. And then there are supplements, sometimes with relatively minor surgeries where there's very little physical impact. Not that appendectomy is minor, but smaller surgeries that maybe don't take hours. Um, the anesthesia is the biggest side effect. So clearing the chemicals from your body from anesthesia can be can take longer than healing the wound sometimes.
Right.
So there's supplements that help support your liver so that your body can detox from those chemicals. And yeah.
Yeah, I had this gave me a flashback to when I was younger. I had my tonsils out, and
Uh,
my parents were super into homeopathy. So but not listening to the doctor and ignoring my mom and being very frightened because the doctor kept talking about how after surgery I was likely going to vomit. So I was super frightened of vomiting as a kid. And I remember front loading with all these homeopathic remedies. I took Nux vomica, I took Arnica, because these were the things my mom would give me when I got hurt or if I was feeling nauseous or sick. And I took them, and the doctors afterwards were like, "Oh yeah, I'm really surprised he didn't vomit, and he's doing really well." And I just blurted out that, "Oh yeah, well, I took a bunch of meds to stop me from." Oh, the surgeons freaked out. Like, what did he take? What could he have taken? And then, of course, they found out that it was homeopathic. My mom was like, "What did you do?" But it was for me. I was like, it gave me the confidence, but also knowing that those subtle frequencies of these things in homeopathy can make such a big difference. That still to this day, it's something that I will turn to, when there's pain, when there's things that you need to get through. So it's really great to hear about them being used by the surgeons now instead of necessarily something that patients have to sneak in and use without that guidance.
exactly. Yeah. Yeah.
So, as far as other Chinese medicine goes, like I think people think Chinese medicine and they think herbs, they think acupuncture, and that's kind of where they leave that. And I know that, and you mentioned this too, that people do get acupuncture prior to surgery in some cases, and also I think as a post-surgical way to help recover as well. Could you just explain like the different ways that Chinese medicine can apply to surgery for patients?
Of course. Yeah. So again, your health is all about balance, so like looking at the whole person and not looking at just one part of you. And, I think that's what I love about blending both Chinese and Western medicine, because Western medicine offers that like detailed, in-depth look at some part of your body, but the Chinese medicine offers that look at your whole body and the flow of energy and how everything works together. And as much as possible, you want to have everything working together in order to heal any part of your body, like anything, right? A joint replacement or a appendectomy or tonsils. You want your whole body to support you in that healing journey. So what acupuncture does, with specifically using acupuncture, well, first of all, before surgery, I help a person's liver energy flow better, their whole body be in better balance in relation to that potential operation. And then I also work to get wherever the operation is planning to be, to help support that part of the body as much as possible, so that when the surgery happens, energy keeps flowing, because an incision in your body can create a scar. A scar can be another energy blockage. And because if let's say you already have pain in this area, there's a blockage there already. So you want to remove the blockage as much as possible before you even get to having the operation. And then after the operation, you want to keep that energy flowing so that the scar does not become a block.
Mm-hmm.
And in the way that I practice acupuncture and Chinese medicine, it's all about keeping energy flowing and finding the signals that the body is giving in order to not create blockages, if that makes sense.
That makes total sense. We do so much work with scars here, and we use microcurrent to try and neutralize the scars because you're right, they block the energy of the body, right? And then what can you do? How can you heal? And how do you tie that in with herbs and things? Is that all about the same thing, supporting those different organ systems and keeping the body flowing?
Yeah. Yeah. I use herbs and supplements and vitamins and all the things. Yeah.
Everything people need.
Help whatever is needed in order to help things be as supported as possible. And again, hormones play a really big role here. I think I mentioned a patient who didn't entirely do what I said. Well, one of the problems was that she had a very low cortisol level, and cortisol is your stress hormone. And when you have when you have surgery, your stress hormones are used in order to help recover because the body is experiencing this big trauma. Like we're so lucky that we have the opportunity to have anesthesia and not feel that pain. But even if you don't physically or mentally feel that pain, the body experiences that.
Yes.
And so you need cortisol, you need the stress hormones in order to be able to function, So that's the thing that she didn't do is she didn't take stress hormone support in order to recover from the surgery. And that she already was a person who had fatigue,
Oh yeah.
you know. So then that created more fatigue because her body was all so stressed from that operation.
I hadn't really considered that before, but it's true, right? If you don't, like you said, if you don't physically feel it, you're still experiencing it, and your body is still experiencing it on an energetic level, and it's a very traumatic thing, especially for some of those deep surgeries, right, that happen and are very invasive. And the body seems to hold on to trauma, right? And it holds it, and I think a lot of the time we're just as the human race not very good at um processing that trauma. And I know Chinese medicine can help with that as well, right?
Right. Yeah. I actually have a series of acupuncture treatments I created for PTSD,
Oh yeah.
help remove trauma from the cellular memory. And oh, I think I created it about 15 years ago, but it's helped so many people get over things, where they can say my life has never been the same since
Yes.
this event. Yeah.
Yes.
So
That's
so
gonna
yeah.
hold people back, right? To be able to be rooted in something that happened to you, as you said, 15 years ago, and it's just totally like ruining your life. Even if you're not really making that connection, it's there. That's an interesting way. My life's never been the same since. That's a good way to think about it because you hear that a lot from people, but you never really put that connection of that's a trauma on that spot right there.
Right, right. And when you say that, there is actually a series of acupuncture treatments that can shift that.
Mm. Interesting. Well, we'll have
Yeah.
to have you back on the show and talk about that at some point because that by in and of itself is life changing for people.
Yeah, that could be. Yeah. Yeah.
Awesome. Well, Shiroko, thank you so much for joining us today. It was a pleasure having you on the show.
Well, it's been a pleasure talking to you. Thank you for having me.
And for those of you wanting to learn more about Shiroko's work, I'm going to leave all of her contact info in the show notes at painfreeforlife.com/podcast. Until next time, I'm Dr. Rob Vanbergen, and you are listening to Pain Free for Life.